All right, this is Dr. Jawad, and I'm going to be going over the dry skin model. Now, just to note, there are different variations of this model. I'm just using our basic model, okay? So when you talk about the skin, you want to break it into three sections. We have this outer section, which is the epidermis. We have a thicker middle section, which is the dermis, and then the subcutaneous layer full of adipose tissue. This is the subcutaneous or hypodermis layer. So when you talk about the epidermal layer, you have 5 different layers. The mnemonic is come less get sunburned. So this outer layer, which is a stratum corneum, this is keratinized, stratified squamous epithelial tissue, and this is the most dense layer. It has anywhere from 20 to 30 different layers, and it is dead skin tissue. Underneath it, the stratum lucidum, which is, it's only a couple layers thick, and it's only present in thick skin, which is the thick skin of the palm of your hands or the soles of your feet. Now these 2 layers, these are dead skin cells. Underneath the stratum lucidum is the granulosum layer. It's not that many layers. You're looking about 3 to 5 layers deep, and the stratum granulosum layer, the signification of this layer is the transition of the live skin cells to the dead skin cells. Underneath this granular layer is a stratum spinosum. It has a spine-like appearance. It's about 10 layers deep. And underneath the stratum spinosum is the basement layer, which is a stratum basale. Now, the significance of the stratum basale layer, this is where mitosis occurs. Remember, when the mitosis occurs and it replicates the new skin cells are laid in the spinosum layer and they get pushed upwards. And then they transition from the live to the dead skin cells right around where the lucidum is, because the lucidum, which is present in thick skin, and the corneum is all keratinized dead skin cells. The basal layer, the basale layer, also has the cells are called melanocytes. Now, what are melanocytes? Melanocytes, these are the skin cells that give us our skin color, our skin pigment. Now, we all have the same number of melanocytes, but what differs is the amount of melanin per person. So somebody who's more dark skinned, we all have the same number of melanocytes, but the amount of melanin differs from the individual. So a darker skinned person has more melanin, to a fair skinned person has less melanin, and that's produced in the stratum basale layer. So underneath this layer, we have the nipple-like ridge appearance, and that's called the dermal papilla. Now, the first 25% of the dermis layer, because the dermis is separated into 2 sections, the top layer is the dermal papilla layer, the papillary layer, and underneath is a reticular layer. This is more thicker tissue. The papillary layer has the nerve endings. These nerve endings here, these are called the Meissner's corpuscles of touch. Now, the function of the Meissner's corpuscles of touch is it's rapidly adapting, it's encapsulated, it is myelinated, and this senses like light touch. So when you go for an examination, the doctor pushes wipes a cotton ball on your skin, or even if you want to sense a mosquito, this is the nerve ending that's firing, and it's rapidly adapting. And this is the papillary layer, which is about 20% of the dermis layer, and it's filled with areolar loose connective tissue. Now, moving along, and you can see here that there's a lot of blood vessels in this papillary layer, and this is underneath the autonomic nervous system control, because this helps control skin temperature, body temperature. When it's hot outside, what happens? The arterioles dilate, okay? So it wants to release the warmth. And when it's cold outside, the blood vessels constrict because it wants to preserve the heat down the dermal layer and below. So we have these sweat glands. Now, the true sweat gland, the sudoriferous sweat gland, this is the eccrine gland. This is the most common, and this is our true sweat gland, and it's underneath this. It's under the sympathetic nervous system. And what happens when the sympathetic nervous system gets stimulated due to excitement, or if you want to cool out your body temperature, it does secrete a watery liquid that comes out to the outside of the skin. Next, over here, this is the sebaceous gland, and as you can see here, it's attached onto the hair follicle. Now, the function of the sebaceous gland is that it secretes an oily substance called sebum. And what sebum does, it allows that nice oil, that nice lubricated liquid attach onto the hair follicle, which helps prevent the hair from drying out. So that is your sebaceous gland. Now, this muscle right here is a very important muscle. This is under the autonomic nervous system, and this is the erector pili muscle. What that means is that it's underneath the autonomic nervous system control, so when you get excited and you get chicken bumps, chicken skin, or goose pimples, this muscle contracts, it stimulates the hair follicle, which allows the hair to stand up. Now when it comes to the hair, now this is another skin model that we have. You'll see the tip of the hair coming out of your skin. Okay, so I'm just going to put the pencil right like that, so that will signify the hair. So I always say the outside of the hair, this is what you shave. This is the hair shaft. The part of the hair that the erector pili muscle, when it's contracted, it stands up on, this is underneath the skin, this is the dermal layer, this is the hair follicle. And like the dermal papilla, which is a nipple-like region, we have the hair papilla. And there are different structures of the hair papilla inside that I'm not going to go over right now. So underneath this layer here, this is the dermal layer. I'm sorry, this is the reticular layer. And the reticular layer, this is 80% of the dermal layer, and this is filled with dense irregular connective tissue. Underneath the dermal layer, we have the subcutaneous layer or the hypodermis layer. And this is a lot of fatty tissue. You can see here all this adipose tissue. Yes, you can see some blood vessels, you can see some arteries and veins here. And this onion-like appearance, this is another nerve ending. And this is called the laminated Pacinian corpuscle. It's deep into the connective tissue, and what this does, this signals the mechanical stimulation. It's rapidly adapting, and this senses the gross pressure changes and vibration in your skin. Okay? So I hope you enjoyed it. Please leave a comment down below, and have a good day.